Hello. Today we're going to be talking about the adulteration versus misbranding, and I'm also going to be talking about briefly about some of the important legislations that are in the pharmacy practice. We're just going to get started. So to begin, just like what I said, we're going to go over first the adulteration versus misbranding. This is just a really good table that distinguishes between what's included in adulteration and what's included in misbranding. But essentially, what differs between these two is that one is involved with the drug itself, and then you have misbranding that looks more so on the label. Okay. So, to begin, adulteration is basically considered if a drug is in a filthy, or if the drug, sorry, it's a filthy, putrid, or a decomposed drug. Or a drug could be also adulterated if it's kept under unsanitary condition, meaning if it's kept under extreme temperatures, meaning too hot or too cold, in which a drug is not normally supposed to be kept under those conditions, or if it's kept under certain conditions where it could be dirty or filthy, those kinds of things. But also, adulteration deals with strength as well. So if the strength differs from what is listed from USB or quality or purity wise, it could also be considered as adulterated as well. But these bullet points right here, these 6 bullet points, are just an expansion of that definition that we just talked about. So adulteration could include improper preparation, packaging, and storage of those drugs. So we already talked about if it's kept under extreme temperatures, if it's kept in a filthy or putrid place, that could classify as adulteration. Also, a drug can be adulterated when there's improper manufacturing methods or improper manufacturing processes. So if if it's on that manufacturing processes messed up the drug in some sort of way, whether there's another flavoring that the drug is not supposed to be there, right? So that is considered adulterated because you're tampering the original drug. Another thing as well is that if it's not conform based upon current good manufacturing processes, we're going to explain that what current good manufacturing processes in future videos. And then also, if the strength, quality, or the purity differs from what is listed on that USP or that United States Pharmacopoeia, which we're going to talk about it more in future lessons, as well as the fact that if a drug is poisonous or deleterious, meaning it's toxic, it is also considered as adulterated. Just like what I said, misbranding deals with the label. So anything that deals with false labeling or the fact that the label is misleading in some sort of way, it is considered to be misbranded. In order for it to be misbranded, these are some of the running lists in here, but we're going to expand it further in the next subsequent slides, what's included in that misbranding category. So for instance, if the name of the label is missing, so typically if the generic name is missing on the label, that is considered to be misbranding. If there's lack of inactive ingredients, specifically on the over-the-counter medications, and also for prescription medications as well. But the only reason why I talked about it on the OTC is because that's what's included in every over-the-counter products that we see. Other things as well are missing cautionary statements. So this missing cautionary statement includes certain medications such as those that are sedatives or tranquilizers. They need to have a certain statement in there, such as you cannot drink alcohol while taking this drug. Um, or in addition to that, if in certain drugs, those that are a controlled substance, which we're going to be explaining in future videos, if it's C2 through C4, they need to have certain statement as well, such as the drug needs to be only possessed by that user and not someone else. The other thing as well is missing warning statements. So, of course, there are some medications that have certain warnings. We already talked about a couple of them. And with this is just a drug specific thing. So if that is missing, that is considered to be misbranded. If it's a false or misleading label, as I just talked about. The other ones as well is that if you dispense a prescription drug without a prescription, that's considered to be misbranding. If you refill the prescription when there's no valid refills, that's misbranding. If there's an inaccurate info, whether it comes into the label or the prescription, that's considered to be misbranding. And not having tamper resistant labels, that's misbranding. Okay, so just like what I said, we're just gonna further expand what needs to be on an OTC label. So on an OTC label, you need to have a principal display panel. You also need to have a name and address of the manufacturer, packager, or distributor. You need to have net quantity of contents. So, for example, it will basically say, um, this is how much Tylenol is in this bottle, for instance. When you read what's on those OTC meds, another thing as well are cautions and warnings. Um, Typically, with some of your NSAIDs, they'll start talking about Gray syndrome. If a patient who have a viral infection and concomitantly is taking NSAIDs, so that's something to be put as well on those OTC med labels to prevent it from getting misbranded. Other things as well is that adequate directions for safe and effective use. Um, and also for the prescription medications to also deal with the use of those medications to provide adequate directions for it as well. And other thing as well that needs to be included in an OTC med are the drug facts panel. These are lengthy, but we're just going to go over them. So in a drug facts panel, you need to have an active ingredient. You need to have a purpose. Purpose in here means what is for, and then use, um, which is indication, D, which is warnings, some of the things to look for, E is directions. So in most over-the-counter medication, they will explicitly say for how many tablets are you supposed to be taking under certain hours or so. So that's the direction component of it. And then other information that needs to be included as well in that over-the-counter medication. And then inactive ingredients, in which it needs to be listed in alphabetical order. And then finally, questions that are not really important on those OTC med labels, followed by a phone number of that manufacturer. And then lastly, it needs to be confirmed with the Poison Prevention Packaging Act, meaning you need that those over-the-counter medication needs to be on a child-resistant and a tamper-resistant packaging. Okay. These ones right here are supposed to be included in order to prevent misbranding. One of them is patient package insert. So this one is supplied by a manufacturer. In community setting, you're supposed to be giving patient package insert whenever a patient gets a new or a refill medication of certain medications. These patient package inserts are typically contraceptives or estrogen-containing products. In hospital, it's a different story. You're really supposed to be just giving these patient package insert or PPIs before they're going to be taking their first dose of their medication and 30 days thereafter. Okay, med guides. So med guides, what these are is sort of similar to a patient package insert, but this one is a little bit different because these ones are um, deals with medications that have serious side effects or have risk relative to its benefits. So in community settings, you're supposed to be giving these med guides kind of like your patient package insert whenever there's a new or a refill prescription. And with hospital, um, sort of similar to the patient package insert, you're really not supposed to be given that as well more frequently as the community. So that's just something to look for. And then on the right are just some of the examples of what what medications are included in these med guides. As you can see, these medications have definitely risks, such as Accutane, right? With contraception. Other things as well as your antidepressant because of its suicidality, especially among adolescents and teenagers. Warfarin, because it's an anticoagulant, it's a high risk medication. Um, Other things as well in here are Epogen, Forteo, which is teriparatide, Lotrinex, and a bunch of others as well. Um, with RAMs, which we're going to be talking about in future lessons, you need to have these med guides. These are very important to prevent misbranding. Okay. We're now going to transition into legislations. These ones are just pretty lengthy slide, but I'll try to do a pretty good job of explaining what these legislations as this could show up in the MPJE. The first one is the Food, Drug, and Cosmetic Act. So basically, what happened is that there's some like safety concerns. So this led upon the legislation of this act, where um, it establishes the Federal Drug Administration, and basically you need to know that it deals with um, four things when it comes to safety: the food, drug, cosmetic, and the medical devices. So it's really important to remember those. And the main thing in here, just like what I said, is safety: the safety of the food, drug, cosmetic, and the medical devices. The second one is the Durham-Humphrey Amendment Act of 1951. So this one deals with how we classify drugs based upon prescription or over the counter. But basically, in order to classify between prescription or over the counter class is basically whether or not these medications are safe to a relative user. So meaning if it's something that is like benign, that is something that could be placed as over the counter. If there's like risks or some things that are needed extra on it, that is typically considered as a prescription. So that's going to classify it in those into that particular bucket. The other important thing here is verbal prescriptions and prescription refills. So this act authorized that. And once again, the main thing here is drug classification, whether it's over the counter or prescription, and also prescription refills. And then on this slide as well is the Kefauver-Harris Act. So remember, in Food, Drug, and Cosmetic Act of 1938, uh, they only need the drug to be safe. This one needs to be safe and effective. It also establishes good manufacturing practice and also It also establishes FDA jurisdiction over prescription drug advertising. And then here is the Prescription Drug Manufacturing Act of 1987. This one basically bans reimportation of prescription drugs and insulin products in US. Of course, there's some exceptions into that rule, such as if there's any shortage of medication, we can actually re-import some of those drugs, such as what happened actually. I believe it was last year. So remember, I just wanted to emphasize that. So to give you all an example, the prohibition. So like in 2020, the FDA finalized regulations that permit sales or Indian tribes to serve as a sponsors to import drugs from Canada with detailed requirements. There are some few states that have passed laws to allow drug importation from Canada, um, but there's no state plan that has been approved by FDA or it was implemented. So that's just something to know. But I wanted to emphasize those things. But the other thing that I wanted to emphasize as well is that this prohibition is on the reimportation of drugs produced in the US and then exported. So that's the big thing. The other big thing in here is the banning the sale, trade, or purchase of drug samples. So when it comes to drug samples are basically prohibited when it comes to sale, um, except for certain circumstance, such as if a provider has requested a drug sample, and typically this is what we've seen in like hospital settings. That's fine, but we can't sell those drugs. And also the pharmacy and the prescriber has to do some record keeping that goes along with it, as stated here on the third bullet point, which deals with storage, handling, and record keeping of drug samples. And then lastly, we're going to talk about the Drug Quality and Safety Act of 2013. So this one deals with the Drug Quality Act and Security Act, and specifically the Drug Compounding Quality Act. So with the Drug Compounding Quality Act, it establishes two different buckets. So the first one is traditional compounding under 503A, and then you have 503B that deals with outsourcing facilities. So I'm just gonna talk about them more in depth, what these compounding and outsourcing facilities are. So compounding facilities, these are under 503A, and they need to be then they need to have a patient-specific prescription or medication orders in order for it to be 503A. The special thing about 503A, um, they really don't need to meet CGMP compared to outsourcing facilities, which we're going to talk about it more. And with compounding pharmacies under 503A, they're permitted to do what is known as limited anticipatory compounding. So what these are is that if you know that they've been getting certain types of products that requires compounding historically, so if they've been, for example, requesting estrogen products, um, and been receiving it every 30 days, and you know that the patient don't really have prescription for it yet, you can start making those compounding products because you know that the patient has been consistently getting the same product, the strength of it doesn't change. And the thing about it too with compounding pharmacies is that they're subject under 797 standards for sterile compounding. So that's important to know. And then the other thing as well is for those outsourcing facilities, which are the 503B facilities, they're allowed to compound sterile products without those patient-specific prescriptions. So the only thing that differs between the compounding and the outsourcing facility is that compounding requires patient-specific prescription, while outsourcing facilities, you don't need one. And that with outsourcing facilities, they're also subject to good manufacturing practices and that they can ship across interstate lines, basically, or intrastate lines. And with under this Drug Quality and Safety Act of 2013, the important thing here as well is the track and trace program. So the track and trace program is composed of three things. So you need to have transaction data, which includes the information, history, and statement. But most importantly, with the track and trace program, it gives a national framework of what needs to be in every prescription. So just like what it sounds like, this one basically keep in track of all the prescription drugs that are actually getting shipped in the United States to prevent it getting adulterated and misbranded. So as I talked about in those transaction data, it includes transaction information. With transaction information, you need to have the strength, name, and dosage form. And then on those transaction history, it's just basically a paper electronic statement that includes prior transaction information for each transaction prior back to the manufacturer. And then lastly, the transaction statement is also a paper electronic statement by the seller that the seller is authorized, receive the product from an authorized person, and receive the transaction information and transaction history from prior owner if required, and did not knowingly ship a suspect or illegitimate product, that the system and processes to comply with verification requirements and didn't knowingly provide false transaction informations. So that's the big thing about the Drug Quality and Safety Act of 2013.